Thank you all for coming out tonight. This is our 116th annual community meeting. It occurred to us the last time we were in this room together was 3 years ago. And if you recall, in that meeting, we had to radio in on a cell phone, Dr. Chan, because we had something new to us that we hadn't seen before. We had a patient that we had received with had a potential to have something new called COVID-19. And you may recall we were scrambling for a quick minute to say, holy smokes, what are we going to do with this? And there was questions about, can we even have this meeting? Do we have to wear masks? What are we going to do? So we tried to scramble really quickly. And if you recall, we had Dr. Chan actually speak and address this group through the telephone that I held up to the microphone. So a lot has happened in the last 3 years, and we're going to share some of that with you this evening. So I'm going to introduce a couple of folks and what's going to happen in our agenda today, and then we're going to get different speakers up here to talk about a variety of different things. The first person you're going to hear from is our chairman, which is Jeff Woodward. So Jeff's going to be up here in just a minute and give you a report from the board's perspective of the hospital. After Jeff's up here, Dr. Richard McKenzie will be up here. Rich will be speaking about the medical staff, how medical staff report, and the responsibilities of the medical staff to ensure that we have high quality and the provision of high quality care here. Next up would be Dr. Duffy, and Dr. Duffy is going to speak about one of the largest projects that we've taken on for a long time, and that is our EHR, electronic health record, that we've converted. So it's a major multi-million-dollar conversion that we went through, and he's going to share some of the details of that major project, which was very successful. Next up will be our Chief Financial Officer, Stephen Schaefer. He'll be giving an update to you about the quality and how well the hospital is doing financially. He'll actually be pitch hitting for our treasurer, who is not able to be here this evening. Next up after that will be Corinne Saperchi. She's going to give us an idea of what our standards of care look like here. Corinne's going to also speak a little bit about some of the other collaboration efforts that we have throughout the region with a number of different collaborative partners that we have. She'll go into great detail with that as well. So with that, Jeff, I'm going to ask you to come right up now.
First, hello. I'd like to thank everyone for coming. On behalf of the Board of Directors, I'd like to thank all the amazing staff here at LRH. It's because of their work over the last 3 years, through some very challenging times, that we've continued to move on and provide the health care needed for our community. Very difficult conditions, as you all know, changing every day it seems. And their staff done an amazing job to be able to bring what the community needs as far as healthcare goes. Because of their loyalty to LRH and to the community, we've continued to provide the community with the highest level of care we can under the circumstances we've had. We've been short-staffed, obviously. Some of the things were shut down because of COVID originally, so they really provided what we can and did an amazing job. LRH was not only able to survive, but thrive through this whole process. So we're very fortunate because there were some pretty scary times as we stopped doing a lot of the surgeries, etc. We also have a very exceptional board, diverse and supportive. Board of directors are all volunteers, and over the past 3 years, they've made a lot of pretty serious decisions as well. I just want to thank them for the dedication to continue to serve in their community. It's been a great group to work with. And lastly, I'd like to thank Bob and his executive team for their great leadership. It's really because of them and the whole staff here that LRH continues to be the leader healthcare in the North Country, and quite honestly, through the whole COVID process, in most cases, and thanks to Corinne and others, we're probably the leaders through this whole process over the last 3 years. If you watch Channel 9 at all, or what was going on with vaccines, etc., LRH was really in the spotlight through that whole process, and it's thanks to all the great staff here. Next up is Dr. McKenzie.
Good evening. Good to see you all today. Thanks for coming out tonight. I'm Richard McKenzie, the outgoing president of the medical staff and a primary care physician. I'm part of a larger team of providers who live here and work here that try to give you the best quality patient care that we can. Quality is kind of top dog around here, and that's what we all strive for. The medical staff is an entity that the Board of Trustees has designated to oversee the quality of medical care at LRH, and we take that role very seriously. The medical staff is authorized to oversee the credentialing of its members, and that means that we provide support to bring quality providers and innovative providers to deliver the best care possible. And to continue to deliver the best of care, we welcome several skillfully trained providers to our medical staff in 22. Recruitment efforts continue in our new fiscal year to add providers and services that align with the healthcare needs of our region and to fulfill LRH's mission. As part of providing the best of care to you, this past year, LRH converted to the new electronic health record, which I think Dr. Duffy is probably going to expound on some more. The medical staff was involved throughout the selection process and helped to select Cerner, one of the leading EHR systems. From a provider's perspective, our new system allows staff at all points of care to see what's going on. For example, my patient in the ED, I have access to their healthcare record as they're being seen, and the nurse in the ED has access to notes in my clinic, so we have better communication. This has been a big change for all of us. I know it was a big change for you as patients. I know it was a big change for the staff and also for the providers. Converting to an EHR is a major undertaking, which does not come without challenges along the way. And we're still learning about some of the functionality even 4 months in. We know that there were some access issues during the implementation, partly due to staffing and partly due to just us learning the new system. I know it was primarily true in primary care. I know there was some frustration in trying to get appointments. We tried to respond to those by restructuring our phone system, currently using some interim providers to help us, have enough appointments and openings, and trying to get the rest of the work done so that you get your prescriptions on time, you get your labs done, and your chronic care issues taken care of. And also, in addition, your acute care. Our ultimate goal is to care for our patients, and when our ability to do so is impacted, we take immediate action to remedy those problems. And it is particularly frustrating to us when we can't deliver the care that we know that we can, and apologize for that. So yes, we had growing pains, but having one system is critical to delivering the best care that we can. It actually has helped in some of those ups and downs in helping us communicate better with each other, even when couldn't get an appointment or whatever. If you went to the urgent care, I could see immediately that you were there and what was going on. So that helped in that department. As I was saying, we had added a bunch of new providers. The new providers that we have Dr. Del Prado in pain. We have a Dr. Sarah Reynolds in pediatrics. Emergency medicine, Dr. Ashley Fox. Sports medicine, Dr. James Alex. Neurology, Dr. Sergio Salazar. He's not joining us quite yet till the summer because he's finishing up his fellowship at Harvard. In general surgery, Dr. Ben Schurer. OBGYN, Dr. Eric Siegel. In family medicine, we have two new providers, Meg Amadon and Sarah Maroon, who actually already, as LRH employees, have 40 years under their belt. So they've been here all along and continue to elevate their careers and are going to do well in primary care, I know. And of course, our exceptional staff is who allows us to take care of people and get the job done. Whether it's techs in the laboratory, our nursing assistants, our MAs, our nurses, and even our facility and housekeeping staff. Everyone on the team is important in getting the mission done. And I want to thank all the wonderful nurses who have helped us so much along the way. So I now want to introduce Dr. Duffy as our next speaker.
As we kind of gather for the 116th annual meeting, 116 of them, I've been to a quarter of them. Okay, I'll give you a perspective. I see how the organization has changed over the years and what it's become. And it's because of the hard work of the medical staff, the other clinical staff, and the rank and file who work every day in the hallways doing other tasks, and as well as the leaders over the years. What is Littleton Regional Healthcare today? Well, everyone will say it's a critical access hospital. Well, but while it's a critical access hospital, it functionally performs as a true community hospital. It has an incredibly large breadth of services for a critical access hospital. In fact, we could be arguably, and have been told by consultants, that we're arguably the largest critical access hospital in the United States. Now that's a good bragging right, but it means a lot to the community because the fact that we are big and we've sustained this large organization with community support, we're able to do a lot of services here. Services that you don't usually see at a CAH, that's usually cut at a CAH. Maintaining obstetrics by itself is a heavy lift that we gladly do. And there are a number of other things as well. 2 neurologists, unheard and 2 well-trained neurologists to boot. So LRH functionally is a community hospital. We utilize the team approach to healthcare. This is a team sport. When I graduated medical school in 1985, it wasn't so much a team sport. It was about the swashbuckler. In emergency medicine, I was in surgery and then went and did residency and went into emergency medicine. We learned that it's a team sport, and we fully embrace that concept here at LRH. Team approach will get you not only the best patient experience is great, but your outcome has to be great as well. And we're looking for both here. We maintain essential services. We expect the highest quality. You'll hear that over and over again tonight. We mean it. We make fundamental changes from time to time because we're not satisfied. We are driven to serve the community. That is number one for the community. Without the community, there's no reason for us to be here. Our product is medical care, and it's for the community. Every day you have to look in the mirror when you start your day and you have to say, this is what we're here for. And I think a large majority of our people do that every day, and that's part of the secret sauce that makes it work as well. Let's talk a little bit about being a team sport. We have a number of collaborating partners that we've developed over the years, and I'm talking 4 or 5 years now. One of our partners, Indonesia Community Health Services, we have a number of clinical agreements with. They've been our partner for a very long time, longer than that. But we now have a clinical affiliation with Dartmouth Health and with Midstate Health Center in Plymouth. These affiliations allow us to do things, to move patients back and forth, to share services bi-directionally so that both organizations benefit. It also helps us be able to maintain access. Access not only for people who can, quote, afford it, who can afford medical care today, but people who are underserved for sure. We have expanded access and are about to announce, although I can't tonight, the details of an exciting collaboration on behavioral health for the region. Keeping the patients close to home with health care at your address. This is your address. This is your home. Sure, there's going to be some times you're going to have to leave us. Frankly, Dartmouth sends people out. Mass General sends people to another hospital across the city in Boston. NYU does the same in New York. Nobody is an island. It is a team sport. Some of our other partners are Clear Choice MD, which we've partnered with a joint venture agreement in Lincoln to help bring health care to Lincoln. If you've all been down there, it's a beautiful building. We expect more out of the Lincoln market through that collaboration and others in their collaboration with Midstate. For years, we've been collaborating with Quorum Health Resources, known as QHR now, over 40 years. When I got here in 1990, they were already here, and they've done countless good for us, and we think we've helped them a little bit over the years as well. But we still use QHR and utilize their resources. And I want to mention Harvard Pilgrim Healthcare, which is now part of the fancily named Point 32 Health. We've done a couple of things with Harvard Pilgrim. One of them is create an insurance product to try to lower the cost of health care for our employers. So employer offered health care in the region. And we've also collaborated with them on a charitable mission to bring health care closer to actual your home. So when you can't come to the hospital, to make it to your home. And we have a beautiful new vehicle outside that is utilized by our new mobile integrated health program, which is a program staffed by paramedics to check up on you at home after you've been to the hospital or had a visit, to make sure that things are going well. Do you understand your instructions? Are things going well? Is the house okay for you? Can you get around? That kind of thing. So with HP and the infrastructure that they're going to give us, along with help from the state and the federal government and our mobile integrated healthcare program, we're bringing the care right to your home, right to your doorstep. Let's talk a little bit about the EHR. Rich has already mentioned that, of course, and most of you know about it. This is a game changer. We have a state-of-the-art single platform electronic health record that everyone who's authorized to look at can see what's going on with the patient in real time. We were on 5 different platforms. They were grown up over the years. We were one of the first people in the area to have an electronic health record. Well, after 16 years, it shows, right? It's a beautiful new car when you bought it in 1960, but by 1980, it's probably time for a trade-in. And we needed a trade-in. We have all the new bells and whistles for this on this. And it brings us clinical efficiency. Efficiency's good. There are no improvements in outcomes and safety. There's plenty of studies to show that these will do that. There's enhanced decision support for physicians, other providers, and clinical staff to help them make decisions to stay on the path for the best practices for a patient. It's complicated. When I was first training, there were many less treatments available, and they were less effective. Today, there's lots, and there's lots of pathways to take, and having an EHR that can help you with that pathway is worth its weight in gold. We do have better performance capture for what the physician or the other provider or the other clinical staff is doing. That helps you get a more accurate medical record. That increases the precision of your visit and your follow-up care. And it also helps the bill a little bit better. And you'll get a bill that's more representative of reality. And it will decrease IT costs, which means we'll be able to invest in other programs. Now, one little plug for the patient portal. You all have a brochure on your seat. This patient portal is going to be able to allow you, when you sign up if you're a patient of LRH, to pay your bill, make an appointment, get information. Every time a piece of information is available to the doctor, Dr. McKenzie sees you and he orders a blood test. The minute that blood test is available, it'll go into the portal. You'll get to see it yourself. Now, that's incredibly innovative, but the federal government says we need to do that. So we're able to do that, and we haven't been able to really play by the rules a lot. Now, we got a waiver in the years past because we couldn't afford not to, but now we're state of the art. So the EHR was a big initiative this year to help push us towards our goal of delivering care close to home that's meaningful. And it's a good experience. So with that, let's talk a little bit about, what the result of all this. The result is, good health care, but there's numbers that go with it. And I'll introduce Stephen Schaefer to talk a little bit about our financials now.
Yeah, so I get the dubious task of talking about financials for this organization. Let me back up for just a minute, though. So I came here a year ago. I've been to several organizations, and Bob reached out to me a little over a year and a half ago, and he interviewed me. And I came up here for what was going to be an interim assignment to be the chief financial officer. Well, I got here, and within 3 weeks, I could see that this was definitely a different kind of organization, one that had passion and one that just worked together for the quality outcomes of the patients and the patient experience. So I'm a CFO. Normally, it's all about the dollars. And here, I am employing fiscal responsibility, but always at our meetings, the final outcome is, did this decision result in a positive quality outcome and a patient experience? And can we do it with the monies that we're looking to deploy? So I can tell you, as a CFO here, we are doing the prudent things that need to be done to keep you fiscally sound and a going concern while working on the quality that we have out there. So 2022, our fiscal year, we go on a fiscal year from October through September. So our fiscal year 2022 ended in September 2022. Our budget was to make $500,000 to the operating line. That budget had been incredibly difficult to form because it was in the middle of COVID and unknown, and I really applaud the people before me that crafted that budget. Where we ended, though, was at making $1 million, almost 2 times budget. That was a very difficult task to do. I have some slides later on that will show you that we had some assistance from the government with various entities to the tune of around $2.5 million. But other than that, it was from the increase in volume and the patients they were out through the door, giving them the quality outcome we could. But it was very, very difficult to do that and still make $1 million. At this point, I want to just do a slight tangent so that we all understand we're off for profit. Why do we need to make $1 million? Do we really make $1 million? That money that we do make is reinvested into the organization. Again, I wouldn't want to work for a for-profit organization. I have, but it's not fun because it's all about the dollar and squeezing the dollar to give to the stockholders and so on and so forth. Here, when we make a prudent amount of monies, we know we can then use it to deploy back into the organization. We spend about $3.5 million on capital improvements every year, replacement stuff, and also things to expand upon services. So we accomplished that mission, that's for sure, in 2022, and I'm very privileged and pleased to be a part of it. In 2021, we had 441 full-time employees. Okay, 2022, we had 461, so we only grew by 20. And one of the areas that we've had a tough time with, and so have a lot of our other hospitals, is contracted labor. During 2022, we had over 22 traveling nurses. That's not good from a dollars and cents standpoint. The traveling nursing agencies really gouged us during that time. At the height of their gouging, they were charging over $205 an hour for a traveling nurse. Plus we had to find places to live for them and so on and so forth. Those are monies that are being sent out of our community and to places like Tennessee and the other things. I don't want to be sending our dollars out of our fight. So we're working as diligently as we can to get those numbers down, but it's a very complex project because it's not only getting our salaries in alignment, which we did a lot of in 2022 with the blessing of the board, but it's also finding them places to live even when they get here. So it's a moving target. We're working on it, and it is coming down. But the board and the senior management said we need to make that investment in the traveling nurses because our mission is to be able to continue services and quality outcome. I, as a CFO, could suggest get rid of all the traveling nurses, but that would then turn into services that we can't do. So I'm pleased that our board and senior management agrees that we're going to continue with the mission and utilize some of the robust balance sheet we have to continue with that. So that's one of the reasons I'm here, and I'm blessed to be here for that. This is just a graphical representation of what I said before. When we bill out $225 million, we're lucky if we bring back in $110 million. It has nothing to do with bad debt or anything like that. It again is our contractual obligations that we received from the various payer sources. This next slide is touching on the patient visits. Like I said, we landed on 147,000 patient visits last year, and that was an upward trend, even in the middle of COVID and so forth. So to be able to continue getting the volume that we're getting while having the prudent number of FTEs and things that go with that, really shows that we've got an infrastructure here that can weather the storm and now take us places going forward. This next slide is, and I addressed it before, is we were blessed to get some government funding from the government. This last year was a little over $2.5 million. And I illustrate this because, one, all of these grants were prudently spent. It's a lot of work. I have a great team. Leslie Walker oversees the team that helps tick and tie and make sure that all the expenses are associated with the grant. Can't double dip. Use one expense for another grant. So she did a great job of surviving these grants, meaning, yes, they were giving us some money, but if we couldn't prove that we spent it in a proper fashion, we would lose the grant. So we did survive it. That's great. And now in 2023, $50,000 is all we've received thus far in grant monies. So we're on our own, folks. But yet we still have leftover COVID expenditures. We still have these PPE that we're wearing. And so we have extra costs still overhead from the COVID, but not the money to go with it. So again, it's going to take prudent fiscal and sound planning. But again, I really enjoy being here. I'm very lucky to be here as your CFO. Be rest assured, under my tenure, I'll be always looking to make sure we're fiscally sound, but always with the overriding charge of quality. So thank you very much.
At LRH, one of the reasons I've been here just over 26 years, started as a staff nurse and have continued my career here. And often when people say, why would you stay someplace for 26 years? It's because you really believe in the care that's provided in this organization. I could not serve in this position if I did not believe that our patients get the best quality care, that our nurses, our physicians, our techs, our executive team, our Board of Trustees, all are focused on quality. At LRH, quality is embedded in everything that we do. It's the foundation of our approach to patient care. Our standards I believe are what set us apart. Through the toughest of times, and we've had extremely tough times in the last 3 years, we maintain our commitment to quality. We maintain appropriate nurse-to-patient ratios. You've probably seen on the news across the country nurses striking about first raises and rates of pay, but more importantly about nurse-to-patient ratios and the safety of the patients they're caring for and the safety of their individual licenses. Through all of the last 3 years and all of the staffing challenges that we've had, which have been the worst in my career, we have maintained our nationally state nurse-to-patient ratios. We continually evaluate and implement evidence-based practices. We're constantly looking at how can we do things better to improve patient outcomes. And we're committed to ongoing education and competency. We support our nursing staff, all of our employees in higher education and continuing education each and every year. Even in the years that we have tough budget years, we still budget money towards ongoing education and competency. We employ board-certified physicians and the highest quality of staff. We have physicians who are specifically trained in their specialty and highly skilled clinical staff who are cross-trained to multiple units to support an environment of collaboration. The last 3 years was the gold standard for teamwork and collaboration among the employees at LRH to serve this community. Our commitment to high quality was evident through the last 3 years, particularly at the beginning of COVID, when everything was very uncertain. And then there was a light at the end of the tunnel in the form of vaccines to help us combat this disease. And I'm proud to say, with the support of all of the staff across every discipline in this organization, we led the COVID-19 efforts for the North Country. Littleton was a mark on the news. We were a mark on the map for people who did not know that we even existed, who came here to receive vaccines, to have testing. The Department of Health and Human Services contacted us directly for vaccines many times, always with less than 24 hours notice. I would send an email out saying we have 600 vaccines that we have received from the state, or 2,000 vaccines that we've received from the state that need to be used before the end of the weekend. And each and every time our staff answered the call. Oftentimes we had more staff than we needed. They were all there braving all temperatures, including negative temperatures. Our first clinic, it was minus 15 when I pulled into the parking lot at 4:30 that morning to get set up. And our staff showed up with a smile on their face, ready to meet the needs of our community. In my 30 years in healthcare, I've never experienced a more trying time, but I'm immensely proud of the staff's response to support the community in meeting people's fears. We had patients, community members, go through our vaccine line in tears. They were so thankful that we were here and able to provide that service for them. And we continued it for over a year. And now still offer vaccines through our urgent care, our primary care practice, our women's health practice, and have gone out into the community to area schools and businesses to provide vaccines so that, again, we can make access to care easy for our community. All of this is only possible through our collaboration with partners and providers who share our dedication to delivering high-quality care. Over the past couple of years, we have increased our relationships with key partners. Our relationship began with Clear Choice MD in May of 2020 in Lincoln when we partnered to stand up COVID testing. It was really the first testing in the North Country, and it was a collaboration of Clear Choice MD staff and LRH staff. We had staff that had been furloughed when COVID first hit because elective surgeries shut down, everything kind of came to a screeching halt. And we were faced with a tough decision to furlough our staff. So when we had the opportunity to do this, we pulled staff back from furlough and had them work in this capacity. They were thrilled. They didn't care that they had to travel to Lincoln every day. I think if you talk to some of the staff who were part of that experience, it probably was a highlight of their career as well. Our relationship continued with Clear Choice in March of 22 when we opened a joint venture urgent care facility in Lincoln. Together, we wanted to be there for an underserved market and provide quality, accessible, and affordable care. Since the opening of this joint venture clinic, we're seeing volumes trend upward, and we're proud of the work that we've done to serve residents in the greater Lincoln-Woodstock area and are evaluating ways that we can increase the services that we provide to that market. Ammonoosuc Community Health Services. We have a long-standing and valuable relationship with Ammonoosuc. We share resources. We have several Ammonoosuc providers on our medical staff. And our relationship with them supports a continuum of care by Ammonoosuc being able to refer their patients to our specialist here and to refer their patients to services like lab, imaging, rehab, and pharmacy. We partnered again this year to conduct our community health needs assessment with Ammonoosuc and often work collaboratively on efforts to address identified healthcare needs for the region as a result of that survey. Because of our great success with Ammonoosuc, we adopted a similar clinical collaboration agreement with Mid-State Health Center. Through Mid-State's Visiting Specialist Program, LRH providers are seeing patients in central New Hampshire offices, bringing specialty care closer to residents of that region. Again, increasing access to high-quality care for patients outside of our direct community. Currently, our specialty providers in endoscopy, general surgery, sports medicine, orthopedics, ear, nose, and throat, facial plastics, surgical dermatology, allergy medicine, and sports psychology see Mid-State patients close to their homes. Patients are then able to come to LRH for surgery and other procedures that are outside of the office setting. Mid-State also plays a key role in our Doorway program success. Our Doorway is LRH's substance use disorder clinic, which is located in downtown Littleton. Mid-State supplies our medical director, Dr. Andrea Berry. She is one of their employees, but serves as our medical director. Through our partnership this year, Mid-State participated in our most recent community health needs assessment as well to help us to determine what is needed in those areas where we have relationships so that we can best meet the patient need. Just like Ammonoosuc, our long-standing relationship with Dartmouth Health has allowed us to care for cardiac and dermatology patients for years. For those of you in the community, Dr. Pollack has provided for several years prior to his retirement cardiac services to our community. Most recently, we've grown this relationship to expand in key telehealth areas. Some of our telehealth services were launched just before COVID, and the timing could not have been better. We implemented tele-ICU in September of 2019, and we started to see the COVID impact in 2020, and the tele-ICU services allowed us to keep probably the most critically ill patients we've ever had in this organization close to home. We worked hard to implement these areas so that patients have our dedicated physicians, but we also have tertiary level specialists literally at the push of a button. Our own board certified physicians and our nursing staff are complemented with tertiary care physicians, specialists, and nursing staff. Some of the services at LRH include tele-ICU, which I discussed. Sicker patients get to stay in our community. There are patients who are able to stay in our ICU close to home that prior to us implementing this service, they would have been transferred out of our community to Dartmouth, Concord, Manchester, Boston. We recently implemented tele-ED to assist with our transfer center. We just launched that in December. That allows our emergency department physicians to literally at the push of a button have assistance with transferring patients to higher level care facilities, which transferring patients is a healthcare challenge that's across the country. So us having this service in place will help us get patients to where they need to be much quicker. We have tele-intensive care nursery. This was implemented just before COVID and supports our essential obstetric services. Dr. Duffy, I believe, talked about us maintaining our OB services. We feel very strongly that the community needs an obstetrics unit to take care of women and their babies. Having tele-intensive care nursery, again, allows us to have NICU, neonatal intensive care specialists, literally at the push of a button. They can see what's going on with our baby. We can talk to them about what our next steps should be. And if the baby needs to be transferred, they assist us with that. Teleneuro, it's highly specialized care for this region. Telepsych, this was our first tele-implementation and helps support behavioral health patients in our region. This service is utilized in our emergency department and also on our inpatient units. All of our efforts over the last several years and even prior to that have remained focused on increasing access to care for patients and ensuring that the care that patients get is the highest quality. We're dealing with human beings, human lives. We don't accept anything less than the best for our patients and our community.
Even though it looks like things have been relatively calm, maybe not a lot going on, there's been a lot of work going on behind the scenes. None of this gets done without the dedicated staff that you've seen here, but it really is our staff. It's our people that make the difference here. A lot of places say that a lot. We really mean it. It is our people that make the difference, and we're so proud of the work that they do here for us every single day. All right, so we've got a couple of closing comments I wanted to go over. So this is a slide that really talks about what our focus has been. This should be fairly familiar to a lot of people. Some people talk about this as the triple aim, so you may have heard that in healthcare before. So we still believe in this stuff, right? We're still looking and saying we need to improve the patient experience. So this evening you've heard some of those examples. Pretty much everyone talking about whatever we're working on, we talk about that patient experience. It's good, it could be better, and we're going to continue to look for the best. As much as we can keep moving this ahead, we're going to continue to try to provide the best patient experience we possibly can. Improve population health. It's like a goal you almost can never achieve. But if you don't always start working on that, where are you going to begin? So we begin with a place called Community Health Needs Assessment. So every now and then we go back out, we ask the community, we check with the community, we look at data, we study data, we talk to our partners. And that's why we invited other partner members with us to do this Community Health Needs Assessment, because it is a team sport, as Dr. Duffy said. We've got to do this as a team. And if we do it isolated by ourselves, we're never going to be nearly as good as we were if we had collaborative partnerships out there. So we're very, very strong, very big on those collaborative relationships out there. And the last thing is to reduce the cost of healthcare. It's really hard. Everything keeps going up. And now we have inflation on top of it. We are seriously studying 20%, 22% cost increases to this organization. And as Stephen talked about, as our CFO, our price increases that we receive, reimbursement, has only gone up this much, but our expenses have gone way up. Our board understands this, and we are blessed to have a very understanding board who looks and says, don't worry about the cost as much as you worry about the quality and service that you're providing. So you've heard that a few times. That's not your management team here. This is the board. The board is the one that's pushing high quality, and we want to continue to deliver that. So with the support of the board, I feel very, very blessed that we are in a position right now where we've been able to do a number of really good things. Looking ahead, as we're continuing to focus on things, you've heard some things that we've talked about in the past. We're going to continue to make investments for our patients, for you, for our community. So things that we're looking on there is upgrading technology. So Dr. Duffy and many folks have talked about the upgrade to technology. Any idea how much those systems cost? Any guesses out there? You're not allowed to say, Stephen. Yeah, so if you're looking at like $15 million, you're in the ballpark. I might be understating what the true cost of that will be in there. So it's a huge investment for our board, for our management team to make into software that helps us make sure the care that we're providing is much more integrated. Going from 5 systems to 1, as Dr. Duffy talked about, game changing. We don't have to worry about things slipping through and so forth. We have one system now. It's just going to make our lives so much easier. Modern facility. This facility is just over 20 years old. So one of the newest facilities actually in the state. Frankly, one of the newest facilities in the country. But it's 20 years old. And we need to continue to reinvest. And so that's what some of the surplus goes to as well. When we make a little bit of money, we have to reinvest. And so we're in the process of making some major reinvestments back into this facility as well. including what we announced, I guess it was 3 years ago in this meeting, where we had talked about our emergency department. We need to renovate the emergency department. We needed to fix our emergency department to make room for some of the behavioral patients and challenges we have. Those issues have only gotten worse. We have to adjust the emergency department. We need to have more capacity, more rooms, more privacy, and we need to make sure that we're able to care for certain subsets of patients in a better way. And so we're dedicated to developing that. We designed a new emergency department 3 years ago, and then we had COVID. So COVID has taught us a lot. And one of the questions we ask ourselves a lot is, would you do anything different now that you're on the other side of COVID? Yeah, there's a lot we'll do different. And so the plan that we had ready to start construction with just a few years ago isn't out the window. It's 80% still right, but we need to do things different with air. We need to do things different with space so that when we are able to drop these in hospitals at some point in the not too distant future, we hope, we still can be safe. We can take care of those patients safely, keep our employees safe, keep the public safe, and make sure that we're taking care of them. We're used to dealing with infections. Hospitals are really good at this stuff, and so we can continue to provide safe, quality care for everybody. We just need to make sure our facility is designed in a way that promotes what we're trying to accomplish on that. So the strategic project not only is our emergency department that we need to go back and reinvest in and expand, and we have plans and the board support to do that. We also have to now go back to our Lincoln market. We've got a urgent care down there. We had plans, and if you recall from 3 years ago, we planned on putting a medical office, building more stuff down there, more specialists. And so that's all there too. It's still in the back of our mind. We're still working on it. As we're coming out of COVID and coming out of the EHR implementation, we now are building some additional capacity to start working on some of those other efforts. So investments for our patients, I think we can demonstrate what those investments are, and I think they're really pretty bold, quite honestly. The last one about our people, investments in our people. I couldn't be more proud of the board here. It is very difficult when you're losing money, you're financially challenged, you can see the pressures coming on, you see your inflation coming in, to go to the board and say, we have to keep investing in our number one asset, and it is the people. And you've heard that now tonight over and over and over, because it's real, it's genuine, we believe it. From Dr. McKenzie and his office and everything that we're doing on the primary care and the specialty sides of the practice, I can tell you when I talk to the doctors here, they talk about how great their staff is all the time. We don't say it enough, but thank you to the staff that's in this room. Thank you to the staff that's not in this room. It is the staff that makes the difference in this hospital. So with that, we were incredibly proud to work here when we're able to actually go to our board and say we need to invest in our people. We expect the best. We have the highest quality standards you can imagine, and people that want to work in that environment should be compensated the best. And so we went to the board and we made this case to them, and they said absolutely 100%. There was no questions about that at all. We're going to do this. I couldn't have been more proud of the board and their support that we felt. And so that's the trustees that we have up there, and I'll recognize them in just a minute. So we built in the best of compensation that we possibly could have. And then we looked at our benefit system and said, we want to make sure we have the best benefits too, because we really want to have the best workplace. We know what the best, in our opinion, quality hospital is. So we're able to actually design a benefit plan that actually promotes the use of our own facility, but also provides a vehicle for people to go to other hospitals if they need care beyond what we're able to take care of here. Another huge investment for our number one asset, which is, again, our people. We are striving to be and have the best place to work. Every day we try to say, how do we make it better? How do we improve the lives of our staff? So we've done other things that is not just money-wise or benefit-wise, but we're trying to add other things that are nice to have for our staff as well. So we're always looking for those things. There are a number of people here that just do a tremendous job in recognizing the staff, and they're leading these efforts. at a management level and a staff level that is just tremendous. So what I'd like to do now, just to take a quick minute, before, and I know I'm between us and food, but I'd like to recognize some folks in the room if I could. I'd first like to start with the Board of Directors. May I ask the Board of Directors to please stand up? You guys make the difference. You make our job so easy. And I need to tell the rest of you, our board is dedicated to the quality outcomes of this hospital. And I couldn't be more proud to work with these guys. We don't have conflict when it comes to the issues of what we should be doing. We're very laser focused. When you're thinking about quality as the most important thing that you do and the product that you're delivering, therein lies the difference, I think, again, in this hospital. And I hope there's no doubt in anyone's mind that the most important thing we do is to take care of a person every single day, and more importantly, take care of the people that take care of those patients every single day, because healthcare is an area you can burn out too. It's hard. It's a tough industry for us to be in. So with that, I'd like to invite up Lori Morgan, please.
A lot of people have no idea what we do. You know why we do it, but you don't necessarily know what we do. Somebody recently asked me what we do, and just to let you know, we're not a bunch of wives of doctors. That's probably how it started. Most of us are not married to the doctors. We don't do just little teeny fundraisers every once in a while, throw on a show. We've got a rich history of over 116 years of service to the hospital. The auxiliary started when the hospital started. So this is our 116th anniversary also. We raise funds to spend on hospital-related projects, health and wellness events, employee appreciation events, scholarships, and much more. This year alone, we have spent over $400 to supply books to be distributed to children through the Born to Read and Reach Out and Read programs. They get them when they go for their well visits. We've spent over $1,300 supplying emergency department sweats. We distribute them to people when you come into the emergency department and sometimes you don't have anything to go home in. Well, we have stuff for you, and it's paid for by the auxiliary. We have sponsored the hospital's quarterly online wellness program. So far, we've spent $15,000 this year in doing that. And we've awarded $18,000 in scholarships to high school students and employees furthering their education in the medical field, just to name a few of our bigger donations. This year, we started a program called Scrub In. Employees can donate their used scrubs, and they have an opportunity to pick out ones that are new to them. We ask for only $5 per item, but we have a pay what you can policy. It's been working really well. Scrubs keep coming in. Sometimes money does, sometimes it doesn't, but people are able to get things that in these times it's just difficult. How do we get all this money? It's from fundraisers like our basket raffle. We sell mulligans at the Dr. Moose golf outing. We have pop-up jewelry and candle sales, quilt raffle, and of course our Moose Ledge gift shop. The gift shop is our largest fundraiser, but we've had to change our hours and even had to close the shop on occasion because we're so short-staffed. I mean, just like every place else in the town, any place you go, there's not as many people that are willing to do it, and sometimes you wake up and you're not feeling good. And to call somebody up and say, yeah, can you show up in an hour? Doesn't always work. If you're interested in becoming a volunteer and joining us in the gift shop, we'd love to have you. If you don't want to volunteer, that's okay. Just make sure that you stop in the shop every once in a while and see what we have to offer. Merchandise is unique, the prices are great, and we have a lot of things you can't buy other places. I could go on all night about the great works the auxiliary does, but I know I'll wind up getting the hook. What I will end with is an invitation to join our organization. We have people who are males or females. We have employees and people who just live in the community. We have a place for everyone, for anyone and everyone who would like to meet new people, make new friends, have fun while you're giving back to our organization and the community that we live in.
The best is yet to still come, which is Jürgen Spagola's meal in conference room 1 and 2. And we have some really awesome food in there. And if anyone's been in the past, you'll know what a great job the food service folks do here. And we're really looking forward to that. We'll all be around us. If anyone has any questions at all, we're happy to take those. Feel free to come up and see us. But thank you for coming out tonight. Sincerely appreciate you being here and all your support.